Hey there, Paris residents. Welcome to this very special edition of a coronavirus update. I am your host, Stephen Hale, Public Information Officer for the City of Paris. And I am joined in studio today with a special guest, Mr. Jose Arballo of the Riverside County Department of Public Health. Jose, thank you for joining us today. We're going to talk a little bit about coronavirus. We're glad to have you.
Thank you very much for having me here today, and I appreciate the effort to try and get the word out about coronavirus.
Of course. Before we begin, tell us a little bit about what it is that you do for the Riverside County Department of Public Health.
Well, I've been with Riverside County Department of Public Health since April of 2011. I'm their public information person. And of course, back in January, when the plane from China arrived at March Air Force Reserve Base, we have pretty much been working nonstop. From there. At first, we set up our Department Operations Center over off of Tyler, but now we're here at the county's Emergency Operations Center in downtown Riverside. So it's pretty much busy the last few months.
It's been very busy for Riverside County as a whole, and I know that was that started in January. A lot of people think we didn't see that quite until March, was whenever it really kind of became public. But local PIOs, we were kind of on the ground for a lot of that, and I know you and your team have been working hard on that since January.
You know, and it's been I've learned a lot. I think one of the things that we learned is the need to communicate clearly with residents, people, the community, and it's given us a good opportunity to educate the public just about the importance of public health.
Right, and I think that's why we're here today. Yeah. We want to do a little bit of that. So I've got some questions here we want to kind of run through and just kind of see if we can set some information straight and provide that clarity for our residents here in Paris. And so I want to just kind of start by asking overall, with Paris being in Riverside County, how does Riverside County kind of compare to some other counties across the state as far as our test rates, as far as our case rates and our actual testing goes?
Sure. Riverside County, statewide, when it comes to the number of cases, the number of COVID-related deaths, we are second behind Los Angeles, I guess, unfortunately, in that number. Our testing has ramped up. Again, we're approaching 450,000 tests administered since the beginning of all this. And our positivity rate is somewhere in the neighborhood of 11 or 12, which means we're above the threshold that the state sets of 8% positivity rate. There are other things, hospitalizations. We are down significantly since over the last 2 months. ICU cases as well is significantly down. The one area where the last maybe a few months, maybe the last month or so, has been a bit disturbing is the number of COVID-related deaths, and that we are approaching 1,000 residents who have passed away, which is a very grim milestone to be marking, but that probably will happen within the next 2 weeks or so.
But that's also an important number for us to take seriously, because it is an important thing that we have to address and be aware of as well.
Well, and I know for Paris specifically, I pulled some numbers. I wanted to as of today, Paris has had 1,687 cases, and sadly we've had 32 deaths here. And you'll see, and these numbers are available for public use, is that over the months, Paris has seen an increase of cases every month except for August, and August was down, which is a good sign. That's a good sign that the case numbers are going down, the deaths are going down, and that's reflective of what's happening countywide.
Sure. So when we talk about the phrase flattening the curve, that was one of our big pushes that we saw, especially as we got into the summer. What more needs to be done? How have we flattened that curve, and what can we still do to continue to flatten that curve? Well,
and as you mentioned, like months ago, we were looking at March. The numbers were pretty high, and we ended up doing better. At some point, the county decided to open up some areas of the economy. Then we had the Memorial Day weekend, and that seemed to be a time when things kind of converged. Our numbers really started to grow. And we had talked about flattening the curve months before that, and we did everything from masks, wearing your face cover, social distancing, washing your hands frequently, staying home when you can, avoid large gatherings. Some of the same messaging we have now. But we believe that the Memorial Day weekend was a significant time And then we had the 4th of July.
Sure.
And again, the numbers again rose.
Holiday weekends.
Holiday weekends. And the idea or the thought was that you're going to have these events, and it doesn't really hit at least for 2 weeks.
There's a cycle that comes to it afterwards, yeah.
And we believe the number of, and here's how it works, oddly enough, in that the numbers we're seeing in deaths now are actually related to the July 4th weekend, because when you have the July 4th weekend, you're going to have a number of young people that get sick, come home, give it to their parents or their grandparents. Sure. Those people get sick. Those people who generally are older, have underlying health conditions, they get hospitalized, and we
Sure.
saw a jump in hospitalizations. Those people get sicker. ICU cases went up, and then now the ICU cases are down, but those ICU cases either have to get better, which we hope, or they pass away. So it's a long cycle, but you'll see now the lower numbers of ICU cases now and lower number of hospitalizations will hopefully be reflected in 3 or 4 weeks from now in still dwindling numbers of deaths, which is what we're hoping for.
Sure, and I think that's an important thing to draw too, is there is that little delay, and so people think maybe by July 10th, hey, everything was fine, 4th of July was fine, but we see that kind of cycle in a little bit afterwards. Maybe let's talk a little bit now. We're sitting here 6 feet apart. We're practicing social distancing. We both had our masks. We measured out this table and got our distance here. But what do we know about this virus now that we maybe didn't know back in March? What have we kind of learned? We're playing a little bit of catch up, but what have we learned here?
Well, several things, particularly the rate of, or the susceptibility of all age groups. It's what we know. I can tell you what we know is more, but there are a lot of things we don't know. Why does it impact certain people certain ways? You can have entire families catch the illness, and maybe only one of them actually gets serious enough to be hospitalized. Sure. And you may have people that have very minimal symptoms, or may not even know they have it at all. So that's one of the things we're still learning about. But we have learned that wearing a mask, even a face covering, a bandana, that helps. The social distancing, that really helps. The frequent hand washing. We knew that was the case before, but now we're able to see it through studies and through
some data to support that now.
Yeah, and it reinforces that. The other thing we learned too is that young people do get the disease or the illness. And so what happens is before the first few months of the pandemic, we were seeing most of our cases in populations 50 and over. Now, in the last month or two, that average age of the person who gets sick has gone down. And you'll see that young people then are susceptible. Now, of course, as young people, they're healthier generally. They don't have as many underlying health issues. So their survivability is way higher than other age groups, but they still get the disease.
But they can still carry.
And we also learned that asymptomatic people, those that don't have symptoms, can spread the disease just like people who are knowing it. Without even knowing it, yes.
So maybe we can set the record straight on this. I know you mentioned some masks, and what are the proper masks to wear? We've got our mask here today.
We have these here masks are good to use. What we're finding out now, the things they call them gaiters, maybe are not as good as other things. Bandanas generally are not as good as masks, but we want you to have something covering your face. The other thing is it's not necessary to have the N95s, the medical grade mask. Most people, you do have a certain amount of protection by just even putting on a handkerchief. But we really would prefer a mask, a medical. Sure. We are giving out masks right now that are single-use surgical masks, and so we think those can work. I think the important thing that what we learn is having them. You want to wear it properly. You don't want your nose exposed, or you don't want to put it on your ear and have it halfway hanging down. Right. And you'll see that sometimes, and it's it really doesn't do any good
to purpose.
Defeats the purpose.
If you're going to wear it, wear it right.
Yeah.
We just did a public service announcement on proper mask wearing for our community, and we want to make sure that people are actually covering up their nose and their face when they're wearing this stuff. As we start to see testing take place, and we've really seen an increase in that, where are some good resources to get testing throughout the county? Maybe a good spot where residents can say, hey, I want to go get tested. I think it's also important to remember you don't necessarily have to be showing full symptoms to get tested. Anyone can go get tested.
Yeah, and what we started doing asymptomatic testing several months ago. We were one of the first counties in the state to do so. What we knew already, or we had strong suggestion that asymptomatic people were spreading the illness too. So we wanted to get as many people tested. We've had several drive-up locations, and including one here in Paris at the Paris Fairgrounds. And you can call 800-945-6171. You can go to gettested.ruhealth.org. And online, it has a map, and you can make an appointment off the map. You can find your location. Yeah, based on your location.
Okay, so everybody, if you haven't been tested, we're kind of encouraging folks to get tested on this?
Yeah, absolutely. I think, and we've had people that have gotten multiple tests because, so let's say you get tested. Some people are doing testing every 10 days. What we really want to say is if you get tested, you don't have to come back again and get tested again unless a couple things happen. Unless you know you're exposed to somebody who's tested positive, whether you've gone to a location where there was multiple people, which we don't encourage anyway, but in case that happens, in case you do that, that's okay. But what we're finding out is people are going and getting tested every 10 days. That really is not a good use of resources, and it doesn't do you any good. And remember this above all too, testing is a point-in-time test. So let's say you find out you went somewhere and were exposed to somebody who's positive. You don't want to go tested right away because it takes longer than that period of time for the illness to come and can be gauged. So you want to wait about 4 days. But what you want to do is you want to quarantine yourself.
You still want to quarantine, right?
So
that doesn't mean go out to the grocery store and
and that's what we're finding out is that people are. They think, oh, I was exposed, and then they go get it tested. And in the meantime, they're out doing everything else they normally do.
Waiting for their test.
So if you think you've been exposed and you know that somebody tested positive, you want to quarantine yourself. And then what you do is you go after a couple days, get tested. By now, we had a period of time where a test turnaround time was a little delayed. It was up to 9 or 10 days. Now we're back down to 3 to 5 days.
I got tested on a Monday, and I got my results on Wednesday morning.
Well, there you go. That's perfect.
It was a very good turnaround. And I did the swab in the back of the throat right there. So.
Well, that was the other thing, and I'm glad you brought it up because, there's the options of doing the throat swab, which I've done twice now, 3 times, and then there's the nasal one. Some don't like the nasal swab. They really have a reaction to it. In many cases, you might be able to ask, but the way that's decided is simply on what supplies are available to the testing site.
All specific to our numbers and our resources is that. So you mentioned this a little bit earlier. You were kind of talking about some of our ICU support and our hospitalizations, but how are our local hospitals and our medical staff supporting this throughout? What's that load been like for them, and what's the status of our hospitals? Well,
our hospitals, again, we had a period of time about a month and a half, where our hospitals were really struggling to keep up with the load. Our ICU beds at some points in the county were over 100% of licensed, and that was a precarious situation. The hospitals implemented their surge plans that all hospitals have for the pandemic, and they were able to get through. And it was incredible work by doctors, nurses, staff, support staff at all our hospitals, because it wasn't 1 or 2 hospitals impacted. It was all 17 hospitals that we have here in the county. And now that the numbers have gone down a little bit and slowed, they continue to work hard. They continue to do services. Now some of them are going back to the types of procedures that aren't required. So maybe they're doing voluntary operations or procedures that they may have cut off before.
Sure.
So elective procedures.
Right. There was a delay on
Yeah.
some of the maybe some non-essential services.
Yeah,
for some of that.
one of the other things that's important too is we had a period of time when people were reluctant to call 911 for things like chest pains or signs of a stroke or shortness of breath, and our ER visits were down. And we were thinking, how could that happen? And then we were being told, well, people were afraid to come into the hospital. Well, the important thing to know is that the EMTs, emergency medical technicians, the hospitals, they all have guidelines in place to protect their employees, but also the patients that come in.
Right.
So you'll find out now if you go to the ER and you're not the patient, you're not getting in.
Right.
And they do a screening, a very good screening, so that you're protecting both the patients and the employees. But they are doing some.
They're doing amazing work,
They
and
really
it's something that I also think is important to remember that nobody was really prepared for. I mean, you try and prepare the best that you can,
Sure.
but something of this magnitude on this scale, on this size, they've really done impressive work. Would you say 17 hospitals throughout the county?
We have 17 hospitals, yeah.
That's pretty amazing for a county that services how many?
2.4 million.
2.4 million. I mean, remarkable work. So if you see a doctor or a nurse today, somebody in the medical field, thank them because they've been working for some long hours. Let's talk about a timeline. I think everybody wants to snap their fingers, maybe like Thanos from the Avengers, and make this whole disease go away. But what kind of timeline are we on right now where we're maybe talking about businesses maybe reopening,
Sure.
maybe we get people back? I know there's been a lot of people that have been out of work, or and most importantly, what we're seeing right now as we're recording this towards the end of August is schools. We're going to start with some distance learning.
Sure.
What kind of timelines maybe are we looking at for maybe to get schools back open, as well as our full economy and our full business operations back as a county?
Well, the county CEO, George Johnson, submitted a letter to the state recently, kind of an outline of how we wanted to open areas of the economy and the community, and that included schools. And that letter now is with the state, and they've indicated they're going to respond to it, not only with specifics to Riverside County, but more specifics to all counties. And so, if things go the way they want, there's a possibility that in mid-September there'll be parts of the economy opening up, and schools are the same way. There's eventually going to be a waiver process that schools will be able to apply for. Not yet, but pretty soon. In fact, maybe as we're recording, maybe next week. And so there are things in place. And remember, there is a hesitancy because, as I mentioned before, back in May, we opened up the economy and we opened up particular areas of the community, and we had a pretty serious spike in cases.
And I think one of the phrases that I've heard kind of throughout the county a little bit is this idea of the second wave, right? And that's what you want to avoid. So there's obviously a balance. You want to try and get folks back to work, you want to get kids back into school, but the last thing that you want to do is have a second wave where we come back online for 2 or 3 weeks and then everything cycles through and now we're shutting everything back down again. And we've kind of even seen some of that just based, like what you said, off Memorial Day weekend and 4th of July weekend as well.
Well, remember this too. We're going to have whatever we have, and then we're going to have the flu season. We're going to have our regular flu season. And, again, there's the vaccination for COVID-19 that's potentially coming out in December, late in the year. But we're going to have a vaccine for this year's flu. And so now we're really going to be pushing to get vaccinations for children and everybody else to get your flu shot. Because the last thing you want to have as a community, as a county, and here in Paris, is to have a serious outbreak of flu in the middle of
COVID-19. Right.
Yeah.
So as we would see some of, let's just try and stay optimistic here. And let's just say that we do get back on campus, in some schools before the end of 2020. We won't even put a specific date on it. But what would some extracurricular activities look like? I mean, I know I played 2-3 different sports in high school. We see basketball and football, baseball, and all this. What are we going to see for some of these extracurricular activities? What's that going to look like? Is this something where I know some states have canceled? I think over the past weekend we might have seen the NCAA.
Sure.
They've canceled a lot of college football. You see professional sports leagues that are opening, some are having success and not. Maybe what does that look like in our county for sports and any other extracurricular activities?
Well, I mean, clearly, in my previous life, I was a sports writer. I covered high school prep sports, and those sports are incredibly important to families, to students, to coaches, to schools, and it gives them a sense of identity in a lot of ways. And there's no underestimating that. The one thing that we at Public Health have to look at is what's the best for public health. And it's an unfair for the community in a lot of ways in that our number one priority is the public health. And sometimes the things that our county public health officer, Dr. Cameron Kaiser, has to recommend aren't
not
really,
easy decisions.
not easy. I mean, can you imagine, let's say it happens, but having a football game, a high school football game with nobody in the stands, no cheerleaders, nobody in the stands. I'm not even saying that's going to happen, but imagine some of the things that might be requested. Because we just started having workouts for some youth sports, and they were saying, well, how are we going to be able to do what you say because you can't be within 6 feet of each other? Well, you know, you can do certain football drills, you can do certain basketball drills, you know, swimming, you can do swimming, but there are certain things you just can't do in football because you have to be within 6 feet of each other. And some of them said, well, do I have to wear a mask? Well, you do. And so these are all things, just it's a little opening, but we're trying to get people used to the idea of having a different way of looking at it as you move forward through whatever it is the long run's going to be. Maybe we delay the opening of football season until after the first of the year. I don't know. I think it's something that...
There's a lot of things that are going to have to happen before that. I think the biggest takeaway out of it for me has been my perspective is none of this is happening to us as individuals. It's happening to everybody. And one of our big strong messages that we had in the very beginning of this was take care of your neighbor. Offer somebody some support. Talk to somebody and just remember this is not we're not picking on an individual or an individual family. This is something that we have to take a big wide look at and collectively make decisions. Our leadership teams have to make decisions for the greater good of the community, and so it's not just as pinpointed to we're trying to keep football players or basketball players from having fun. They're tough questions, they're tough decisions that have to be made.
Well, and that's everything from like the city council here in Paris to the county board of supervisors to people like Dr. Kaiser and our public health. Everybody has their own perspective on these things and their own impact. Here's the tricky part with public health. We look at things on a huge level, but then we also get phone calls from people saying my mother and father were in a nursing home and both of them have passed away from COVID-19. It personalizes it so much. I've gotten several of those calls. And so, we look at things from a bigger perspective, but then we have to remember all these numbers that we have on pieces of paper like this are people, they're families. And just because someone doesn't pass away doesn't mean that they don't have the long-range impact of this disease.
Which we still might not fully understand as well.
Our youngest person who in Riverside County who passed away was 19 years old. Our oldest I saw the other day, I think was 103. And the vast majority of people have underlying health issues, but there have been people who had no health issues at all. And so... you're right. We're looking at it from a huge, as we say, 10,000-foot level, but it really impacts individuals. And so, I don't envy the people that have to make this decision.
Have to make those choices. No. That's right. We've seen here in the city of Paris, we have some opportunities where folks can apply for various temporary permits for outdoor dining or for opening businesses. Same as well for our barber shops and hair salons. So we have started to see some businesses start to open. Of course, there's some essential businesses that have been put on the governor's essential business list. But how has businesses opening? How has that fared? I guess across the county, and maybe that will be the new normal. We're addressing some of those new normals, as every day. But how has those types of maybe city directions impacted the county as a whole?
Well, one of the things that we hope to have is uniformity. It makes it easier. People don't necessarily think, well, I live in this area and I should be able to do the same thing in this area. And so for us, as we try to explain things, we say this is the rules as they are now. And so let's say for outdoor dining, you can't be indoors. You have to be social distancing. You have to wear a mask when you're not eating. Those are uniform.
Right.
Now, cities can be tougher. And there have been cities that have been more strict than the county and the state guidelines. But then you also have differences in what cities will allow when it comes to outdoor dining even.
Right.
And so we have to say to people, well, here are the rules that we have, but you need to check with your city individually because their rules might be a little different. And so it's been a little tricky sometimes.
Sure.
And then we have those that really don't follow the rules at all, and we get contacted, whether they're salons or restaurants, and we have to, in some cases, refer them to the state, and the state has come down on them sometimes. In some cases, we've sent letters, cease and desist letters, and eventually trying to get TROs, temporary restraining orders against these companies or businesses, which we don't really want to do. 9 times out of 10. It's
not where you want to see it go.
We don't want to see, and 9 times out of 10, when we contact them, they stop.
Right.
But we also are encouraging people to patronize businesses that do follow these guidelines.
Following instructions.
Yeah. I mean, you go in some of these grocery stores, they got the signs everywhere, wear a mask, social distancing, they have the marks on the floor. Some of their aisles are one way. I mean, it's really impressive, the work that they've done and the thought they put into it. They put the plexiglass in front of the cashiers. Those are things that I think need to be celebrated, and people need to patronize those places.
And that's becoming a new normal. I mean, just a walk around our campus here at City Hall, we've got markers throughout, and we've now have the plexiglass around, and our staff wears masks. We've got hand sanitizers all over the place. So I think that's becoming the new normal, and those are the kind of things that we're going to start to see as we progress through this. Jose, thank you so much for taking some time on this. This is not an easy conversation to have, but I think it's a necessary conversation to have, especially at our level. Our job is to inform public about these types of things. But before I let you go, is there something maybe that you want to plug on behalf of the Riverside University or Riverside County Department of Public Health that would help our residents here?
Well, right now we're just finishing up our Mask Our Medicine campaign. We started in late July to, in 30 days, give out 10 million masks. Well, we just about accomplished that. And we used our countywide groups and nonprofit organizations, churches, schools, businesses, that they would come in, and some groups, the food banks, we gave them over 1 million masks to give away, and they have been giving them away like crazy. We gave them away at our testing sites. So we are just about at the end. We've given away 9.8 million masks, and we're coming up on that. So we appreciate the community stepping up and those small groups stepping up. And we are encouraging people to continue to wear the mask, practice social distancing, wash your hands, and go and stay away from groups of people. I know the holiday and Labor Day. We have one more day
coming up.
But stay home if you can. Stay away from groups that you don't live with, and we'll get through this.
I agree. Jose, thank you so much for your time. I appreciate it.
No problem.
Very much.
Thank you.
Love to have you back again, too.
No problem.
Do this
Thank you.
again down the road.
Thank you.
And thank you, everyone, for watching on this very special edition of the Coronavirus Update. This has been very informative with Jose. Don't forget to like, comment, and subscribe on our YouTube channel, on our Facebook, Paris Today, and follow us on Instagram and on Twitter at City of Paris. For Paris TV, I'm Stephen Hale, and thanks for watching.